What does an H. pylori stool antigen test actually detect? Imagine a simple test that can tell if a bacteria is causing trouble in your stomach without needing a camera or invasive procedures. That's what the H. pylori stool antigen test does. It looks for specific proteins, called antigens, from the bacteria Helicobacter pylori that are present in your stool. These antigens are unique markers produced only by H. pylori, so if they're found in your feces, it means the bacteria is actively infecting your stomach lining right now. H. pylori bacteria are known to colonize the stomach lining and can cause damage that leads to ulcers and peptic ulcer disease. When the bacteria infect the stomach, they damage the protective mucosal layer, which can result in inflammation and ulcer formation. The stool antigen test is a non-invasive way to detect this infection. It works by using immunoassay techniques to identify bacterial proteins shed into the gastrointestinal tract and excreted in the stool. Unlike blood tests that look for antibodies, which can stay in your system long after the infection clears, this test detects the actual presence of bacterial proteins, so it shows whether the infection is active at the moment. This makes the stool antigen test especially useful for diagnosing H. pylori in people showing symptoms of ulcers or gastritis. It's also helpful after treatment to confirm whether the bacteria has been successfully eradicated. Because it's a simple stool test, it offers a comfortable alternative to more invasive procedures like endoscopy. Some tests target specific bacterial components like catalase or flagellar proteins, which are parts of the H. pylori bacteria. The test is known for its high sensitivity and specificity, meaning it's very reliable for detecting active infections. In recent years, more advanced molecular tests like PCR on stool samples can detect H. pylori DNA and even identify antibiotic resistance markers, but the traditional stool antigen test focuses on bacterial proteins. This is important because it helps guide treatment decisions. Since H. pylori infection is a major cause of peptic ulcers, confirming its presence with this test supports the need for targeted eradication therapy. When the test turns negative after treatment, it indicates the bacteria has been successfully eliminated, reducing the risk of ulcer recurrence. Overall, the H. pylori stool antigen test detects bacterial proteins from H. pylori in your stool, signaling an active infection. It's a valuable, non-invasive tool for diagnosing and monitoring this infection, especially when ulcers are involved. If you think you might have an H. pylori infection, it's always best to consult with a healthcare professional who can recommend the most appropriate testing and treatment options based on your individual health needs.